Hello, we are Group 13B, and today we are presenting on meningococcal, meningitis, and Hansen's disease by Macy Proctor, Crystal Mbagu, Reagan Mbagu, and Naga Arya. Meningococcal meningitis. We're going to describe what meningococcal meningitis is. It is a bacterial infection of the central nervous system, CNS, which comprises of the brain and spinal cord. It's caused by the agents Neisseria meningitidis. It is a gram-negative diplococci arranged in pairs. It has capsules. It does not have a flagella, and it does not produce endospores, which is what bacteria use to be able to survive harsh conditions. They possess pili, short hair-like structures that primarily help for adhesion to host cells, and it also has a polysaccharide capsule that protects the bacterium from the host immune system and aids in survival under harsh conditions. Meningococcal meningitis is spread from person to person through the nasal tracts or throat, so this disease can be considered as airborne. The risk of transmission is increased significantly through close contact, like living in the same household or sharing personal items with someone who's already infected. Severe infection can also happen if the disease enters the bloodstream, so needles and cuts are also methods of transmission between people.
Now we're going to go over the signs and symptoms of meningococcal meningitis. So some common symptoms in adults is fever, headache, and stiff neck, and some other possible symptoms are altered mental status, like confusion or lethargic behavior, nausea and vomiting, photophobia, which means the eyes are sensitive to light, rash, and some symptoms in infants may be harder to recognize, but some of the symptoms include slower inactive behavior, irritability, poor feeding, or a bulging anterior frontal, which is swelling of the soft spot on the head.
Treatments for meningococcal meningitis are usually antimicrobial drugs like ceftriaxone or penicillin, which can be administered through an intravenous tube or an IV. If doctors suspect that an individual has the disease, they're likely to start them on the medication, even without obtaining an official diagnosis, because the risk of letting the illness go on outweighs the risk of what could happen if you give them the medication. Other treatments for the illness include corticosteroids, which are drugs to reduce inflammation in the body, surgery to treat dead or damaged skin to stop the necrosis from spreading to unaffected areas of the skin, oxygen treatments, and medicine to treat low blood pressures.
Coming to the epidemiology, so this disease is considered both pandemic, which means it has impacted globally, and endemic, which means it has impacted in a specific region or a country or a state. So it has pretty significant impact all throughout the world. But the primary impact is seen in the African continent, especially the sub-Saharan meningitis belt, which spans from Senegal on the west coast to the Ethiopia on the east coast, over 26 countries. Some things like Niger, Chad, Nigeria, Mali, etc. are some of these countries. Historical prevalence is the most number of diseases cases basically are seen in the year of 1996 and 97, where over 250,000 cases were registered, and out of which 25,000 deaths have occurred. And a current comparison to that would be in the year of 2023 to 2024, where there were about 26,000 cases registered with over 1,400 deaths. So even though we see a significant drop in the number of cases, but overall, this disease is still seen significantly impacting all over the world, with stats of over 2.5 million cases registered worldwide in 2023, with over 259,000 deaths. So primarily, which age groups is this targeted? Infants, which means basically under the age of 1 year old, and young adults in the age ranges of 15 to 24, and old people, which are about 65 years and above. And what's the primary cause of this disease for that particular age group, and why is it specifically seen in that African belt? There are several conditions to that, and some of them are listed here. So the weather plays a major significant role. The dry, hot, and humid weather causes the people respiratory tracts to basically become very less immune to the disease, and by which the people contract this disease pretty faster. And because of the poor living conditions and also the economic conditions makes the people to live in crowded situations, which means close contact of multiple people, which means the disease spreads faster, like through the respiratory tracts. And people who have their immunity compromised through HIV virus also gets this disease very significantly. And also, when you're living in poor economic conditions, the accessibility to different types of serotypes of this bacteria vaccines is pretty hard to get, and that causes the people to get contract the disease very fast. And an interesting case report for this particular meningitis disease is a 21 years old male in a USA military training academy in the year of 2022 has gotten this disease. And he initially showed symptoms of stiff neck, headache, vomiting, myalgia, and soft pellets, basically. The doctors have done some physical examinations to take in some blood samples and also cerebral spine fluid. And finally, they found the presence of Neisseria meningitidis. And after they found the bacteria, that particular patient was put on a 10-day treatment course through IV fluids, basically. And a couple of the administrations that he was given was ceftriaxone and prophylaxis. And because he was in contact with his other batchmates, there were about 70 other people who have also been administered for this disease, and they were also kept under a close monitor, and they were given a few vaccinations just to avoid the disease. So that's one interesting case report, basically, locally in the United States.
Well, serotypes of meningococcus: A, B, C, D, H, I, K, L, W, X, and Y. Each of these are characterized by differences in the polysaccharide capsules, but A, B, C, W, X, and Y are primary causes of meningococcal meningitis. Even with treatments, approximately 1 out of every 10 people who get meningococcal meningitis will die. It might not seem like a big number, but it is. And only the 20% who might have survived from the disease will suffer serious or permanent complications, such as brain damage, kidney damage, loss of hearing, and amputation of the arms, legs, fingers, or toes, basically all the limbs. Hansen's disease or leprosy.
So now we're going to go into the pathogen description of what Hansen's disease is. Hansen's disease, also known as leprosy, is a bacterial infection of the skin and the perpetual nerves. The causative agent is Mycobacterium leprae, a gram-positive rod-shaped bacterium. It typically is arranged in singles or clusters, and these lack flagella. They also don't have capsules, and they do not produce endospores.
As seen as the previous case, Hansen's disease is spread through close contact with untreated individuals or sharing their personal items. The bacteria can enter the body through broken skin or the respiratory system, often finding cooler areas of the body more conducive to their growth. Individuals that are already immunocompromised, like those who have HIV, are at a higher risk of infection than healthy people. Some species of armadillos that are native to the southern US and Mexico can carry leprosy and possibly spread it to humans if the meat is consumed.
Okay, some signs and symptoms of Hansen's disease. So there can be skin changes such as discolored patches, pale, red, or dark, thick, stiff, or swollen skin, numb areas of the skin, and then there's also skin lesions. There's nodules, which are abnormal tissue growths under the skin, lumps, localized swelling or masses, ulcers, which are deep wounds, sores, surface level skin breaks, and lesions on the sole of the feet. And then there are nerve-related symptoms such as enlarged or thickened nerves, or there could be weakness or paralysis in different body parts, such as the arms or the legs. And then other symptoms are loss of eyebrows and eyelashes, or even vision loss.
In Hansen's disease, a method known as multi-drug therapy, or MDT, is used to treat the illness. MDT is where certain drugs are used or taken together to combat the bacteria. Usually these drugs are dapsone, rifampin, and clofazimine. Multi-drug therapy faced a minor setback when rifampin was no longer recommended due to significant drug interactions that could pose health risks to consumers. These drugs are antibiotics, so it's recommended to take them over the course of 6 months to a year, even if one's symptoms fade before then.
And coming to the epidemiology of Hansen's disease, though this disease is not as significantly fast spreading as meningitis. This one too has significant cases recorded prior to the intervention of vaccines. So historical prevalence was in the year of 1972, over 12 million cases was recorded worldwide, and about 5.5 million cases were recorded in 1991. And an interesting other fact is in the country of India alone, there were over 4 million cases in 1980. But after the MDT drug therapy or method was introduced in the late 1980s, more than 16 million people were cured by giving the vaccines to different people. And our current prevalence in terms of data would be about 183,000 cases were registered in 2023, which is definitely a significant drop compared to millions of cases back in 1972 and 1991. So definitely people are seeing a lot of success with this MDT therapy, but still a lot of cases are still getting registered. And primarily, two countries still lead the charts in terms of this disease. One is Brazil, the other one is India, even with the introduction of different types of vaccines. And the other thing is who gets it is basically the age ranges of about 10 to 14 and 35 to 44. The reason for that is this disease is very slow spreading, unlike meningitis. So it takes several years for the incubation period, which is alone is about 5 to 10 years before the bacteria actually start showing signs of decay over the skin and other pigmentation issues and skin related issues. So that's why you see the age range pretty late in the game, as opposed to meningitis, which is pretty significantly seen in pretty much all different types of age groups. And an interesting case report is basically in the country of USA, there is a 54-year-old Florida male in the year of 2023 who got this or shown signs of this disease. And upon doing some research, health authorities have found out that this guy has not made any kind of international travel. But still, basically, he was somehow able to contract the disease. And upon physical examination, they were able to understand with some skin biopsy that there is a presence of Mycobacterium leprae, which is basically considered as positive in the signs he was showing. And he was given few drugs, rifampin, dapsone, and clofazimine. And but though the the disease was um, recovered for him, but he still had some permanent damages, nerve damages because of this disease. So that's one case report found in USA.
This who first recognized Mycobacterium leprae as the cause of leprosy in 1873 in Belgium, Norway. Contrary to popular belief, leprosy does not cause your limbs to fall off, as some may tell you. It can cause numbing of the nerve endings and in the limbs of the body, leading to injuries or infections that could then cause tissue damage or loss.
All right, so we have questions posted for the group on the discussion board. So we would appreciate if you guys can participate and provide us some answers. And we also have references in case anyone is interested to look through. And thank you for everyone for participating in this.